When we look at healthcare today in America, it's an outside-in approach. So we look to the outside of the body and we put something in it to try to shift it, versus looking to the inside, say, what can we do to strengthen the inside to get it healthier? So that's what chiropractic to me is how do we get this thing healthier? So who's responsible for your health? You are, not me, not Kaiser, I'm not picking on Kaiser or anything, but not Blue Cross, they're not responsible. Medicare is not responsible. You're responsible for your health. And so, it's interesting how people that come in and they say, well, if my insurance doesn't cover it, I'm not doing it. Not the best attitude to create as abundant health as possible, okay? So you're responsible for your health. So when your body gets out of balance, symptoms can show up. So things like diabetes, that's just the body being out of balance. High blood sugar, that's diabetes, basically. The sugar gets too high and then the body gets out of balance. It can't handle it. High blood pressure, the body's out of balance. Neuropathy, same thing. Arthritis, headaches, constipation, see it all the time. Acid reflux, see it, that's just the body being out of balance. And there's a lot more than just that, but just remember a symptom is, why am I out of balance? How do I get back in balance? Okay, so let's talk about neuropathy. Now, neuropathy means damage to the peripheral nerve system. That means the nerves that come off the spinal cord, the peripheral nerves. The most vulnerable area of a peripheral nerve, do you know where it is? It's right where the nerve comes right off the spinal cord. That's the most delicate area of the peripheral nerve. And by the way, when you put the weight of a dime on the nerve root where it comes off the spinal cord, it'll block that nerve root anywhere from 40 to 60%. They've got studies on it. So the weight of a dime, that's about how much pressure you could put on your eyeball comfortably. That's all it takes to block the energy through a nerve, 40 to 60%. That's pure and simple. That's mechanical stress on the nerve, or put neuropathy on it. So there's two main causes. One is trauma. Any of you had any traumas in your life? Birth, and then you learn to ride your bike, and then you learn to fall, and then you learn to walk, and then maybe some car accidents. I had a guy who was working at the mill, fell 12 feet, landed on his head, injured his neck really bad, and then suffered 2 heart attacks right after that. Young guy too, in his 30s. And now he's messed up. Then he just recently got in a car accident, and trauma. So he's got numbness, tingling in his arms from that trauma. And of course, disease processes could do it. There's the symptoms relate to where the pressure is on the nerve. Now there's three branches of the nerve system. Here they are. There's the motor nerves, which control muscles. There's the autonomic, which controls the organs. And then of course, there's the sensory. And that's what everybody focuses on, is sensory. But the motor nerves, I'll go back to this. You could have balance problems, numbness, tingling, muscle spasming, if there's pressure on the nerves that control the motor function. If there's pressure on the nerves that control the autonomics, which are basically the organs, that's where you can see high blood pressure. And there's tons of research coming out now on upper cervical correction, which is what we do, on lowering blood pressure. There's a recent study done in Chicago, University of Chicago. By the way, it's a medical school, and the chiropractors did the study. There was a lead medical doctor doing it, and the results came back. On average, the people lost or dropped 14 points of blood pressure. They beat out the people who are on two drugs. And the doctor said, do this study again, we don't believe it. Check it out. So Google WebMD chiropractic blood pressure, and you'll find the story. There's a whole article they did in Chicago about it. So things like heart rate, constipation. We had a lady who used to work for me. Her daughter was born. Arm came out first. So imagine that. That's going to kink the head. Cords wrapped around her neck. And she brought her in 2 weeks after she was born, constipated. So I said, there's pressure here on the upper nerve. Adjusted her atlas, did a little work on her belly, and no more problems with constipation. 2 weeks old. So you just light pressure, it's just light. It's no more pressure than this. To adjust the atlas, it responds very lightly. So people who are scared of the cracking and all that, if I know that, then we can do light mechanical upper cervical adjustments. So that's depending on where the spine shifts, is where the nerve's going to be affected. So that's why you can have somebody respond from all these different things. You could have somebody respond from digestion or breathing problems or high blood pressure or balance problems. It just depends on where the interference is. So That's why when I look at somebody, I don't look for the symptomatology, even though we like to see what it is. We look to see what's causing it. Where is it interfering?